Hi, Steve Lynch, licensed massage therapist at your service, and I'm talking to you from Limestone Therapeutic Massage in beautiful Newark, Delaware. Thanks for watching. I want to talk about a condition today called sciatica. Sciatica. It sounds like a far-off, castle-laden land full of dignitaries and emissaries. Hello, I'm from the land of sciatica, and I bring you bad tidings. Prepare for war. Well, it's kind of like that. Sciatica is like that emissary that's really going to bring you some bad news. I mean, anyone who's had this condition can tell you that it feels like someone has just pounded a red hot wedge in between the end of your spine and your sacrum. There's no position possible that's pain free. You can't lay down, you can't sit down, you can't stand, you can't walk. I mean, it's pretty daggone excruciating. You know what I'm saying? So, but what is sciatica? Let's talk about that for a moment, because oftentimes sciatica is kind of misdiagnosed or misunderstood. And I've done a great deal of study in this condition over the past 20 years as a trainer and therapist. So sciatica gets its name from its actual nerve. We're talking about the sciatic nerve anatomically. The sciatic nerve comes out between the last vertebrae and the sacrum. But it also does this. It runs down through your butt cheek, your hip, your gluteals, if we're going to be correct, and it runs all the way down your leg and into your feet. So this is why when you have a condition of sciatica, you have this excruciating burning pain from your low back all the way down to your toenails. And I know many of you had this. Doesn't seem like there's much you can do. Now, the condition itself can be caused by mechanical means or biochemical means. By that I mean if there's a huge amount of inflammation due to former injury or some other condition that's attacking the nerve root in that way, biochemically, organically, then you can have the sensation of sciatica in that region. More often than not, sciatica is a physiomechanical kind of condition. We can say that, long word, doesn't mean nothing. But what I'm talking about is that the nerve itself can be impinged between vertebrae. Okay, even slightly causes excruciating pain. Everything in the body is like microscopic, but with magnanimously painful kind of conditions attached to it. So when we think about that, there are other kinds of orthopedic concerns like osteophyte, free floating cartilage or bone fragment, or bone spurs. Bone spurs can be excruciating, especially if they develop in the lumbar region. Okay, that being said, there are other kinds of sciatica that are connective tissue and soft tissue related. Soft tissue related sciatica can be anything from an overly tightened and adhered thoracolumbar fascia. I know you don't know where that's at, okay? That's kind of like a triangle of connective tissue that goes from the front of your hips all the way around your back, almost to the middle of your back, and it's like a big thick sheet of saran wrap. Okay, having said that, sometimes it gets stuck on the muscle, stitches and tears, sometimes it can bind up muscle. That being said, then there's other kinds of soft tissue concerns which are muscular. And these are really kind of the things that I want to be concerned with. As a neuromuscular therapist or a clinical massage therapist here at Limestone Therapeutic Massage, we concern ourselves with the musculoskeletal system, but particularly the soft tissue concerns. We're not surgeons, okay, so we're not going to work on the bones. We're not chiropractors, so we're not going to articulate. But what we can do is we can alleviate the condition that is causing this sciatic pain if it is a soft tissue type of sciatica. So if we're looking at, say, the hip, and a lot of times the sciatic condition will develop in the gluteals in the hip, the old butt cheekas. You see what I'm saying? And what happens is, because of the way that the sciatic nerve runs through the gluteals and the hip itself, uh, there is great potential for nerve impingement. Okay, now the sciatic nerve running through the hip actually runs through, and it runs over and under and down and around all these muscles of the hip. So particularly the piriformis and the deep six lateral rotators. So without getting too heavy in the anatomy, what that really means is when you injure those hip muscles, and say you're playing baseball or soccer or swimming, whatever it might be, weightlifting, etc., you can injure these hip muscles, okay? And that can happen just doing anything, even simple housework or gardening or whatever it might be. And the muscles themselves become inflamed, and they just cramp up. And when they cramp up to a certain point, well, guess what happens to that nerve? It's like, oh, gotcha, baby. You know what I'm saying? And that's where the pain really starts to dig in. Once you've got that pain spasm cycle, okay, it's kind of like a loop. It just goes round and round. You get cramp, you get pain, okay, your nerve is impinged and it hurts more, and then you get more pain and then more cramp. So what's the solution, okay, for sciatica? Well, there's a couple of different things. I mean, sometimes if it's an orthopedic concern, you're going to have to endure a surgery eventually. Say that in the case of bone spurs or osteophytes, something like that, or a herniated disc or a ruptured disc. Those are things that are going to have to be surgically addressed, okay? But the other muscular concerns can be addressed by good clinical massage therapists like we have here at Limestone Therapeutic Massage in beautiful Newark, Delaware. And the way that we address those is that we get in and we work with the soft tissue, the muscles of the hip and the low back and the legs and the gluteals, and we alleviate the adhesions, okay? We get things unstuck, all right? Now, when you unstuck something, that means that everything else that's in between it can move and slide freely. So in essence, what we're doing when we work with these massage techniques, these clinical orthopedic techniques, is we in fact release whatever is impinging that sciatic nerve, so that that sciatic nerve now can relax, okay? And you'll get rid of the inflammation by hydrating properly, basic movement, getting that waste product out and in through the lymphatic system by movement of the muscle, okay? Some people like to use anti-inflammatories and pain medication, and also, muscle relaxers. Now, I would say that if we're talking about initial palliative care, that's an immediate kind of care concern. So you want to be open to the idea of some of those things at the initial onset, because you always want to be ahead of the pain. Okay, you don't want to be behind the pain, because that always takes more medication, more effort. But once you get ahead of the pain, and begin to decrease inflammation. And let me just add that the best way that you can actually work with sciatica at the onset is going to be with contrast therapy. It's going to be heat and ice. And as I've mentioned in earlier videos, you always want to end up with the ice. And you definitely don't want to be doing heat packs in the middle of the night before you go to sleep, because that's only going to yield more fluid compaction around that sciatic area, and more lymphocytes, more waste product that the body doesn't have room for in that compartment area. So again, heat and ice are going to be more effective in dealing with the inflammatory process there. So just know that, okay? But aside from that, once your therapist gets in and releases adhesions and can lengthen the connective tissue and the muscle belly back out in these areas where we have the sciatic concern. It's generally only a couple days after that, and the condition is resolved. So we want to think about sciatic as yes, it's a really tough thing. Ain't nobody want to go through no sciatic pain. See what I'm saying? But it's not the end of the world. And the major thing that I want you to take away from this is that it doesn't always have to lead to an orthopedic type of you know operation. It doesn't always have to lead to surgery, and it's not always an orthopedic concern. So think about this. And if you happen to find yourself with this sciatic condition, you know, give your therapist, give your clinical massage therapist, your orthopedic therapist, medical massage therapist, give them a chance to alleviate this condition for you. And I bet you're going to find that the condition is going to be alleviated a lot sooner. You're going to get back in the swinging jungle of life, baby. And life will go on, sweet as it should be. So again, I'm Steve Lynch. I'm representing Limestone Therapeutic Massage in Newark, Delaware. And you can hit me up again at stevelynchLMT.com, or you can hit me up at limestonemassage.biz or .com. And I just want to say, the only thing that is consistent in life is change. And it's not always bad change. So even if you have to change into some sciatica, you can change on out. Have a beautiful life.